Hello, everyone. Welcome to Compton's Corner. I'm William Dakota Compton, and I'm here with,
Spencer Keck, the Hillbilly Think Tank.
yes, and we are honored to be with you all today. This podcast, for those who are just joining us for our second episode, is about bringing people together to talk honestly about what's happening in the Kentucky 2nd Congressional District and to share the struggles and the victories of everyday families and to lay out a vision for a future that works for all of us. Today, in this episode, we're going to be talking about healthcare and how that is going to affect our families here in Kentucky and what we think we need to do to fix healthcare moving forward. So, that is our topic today. And uh, Spencer, what do you think about the healthcare system so far?
Well, we've come a long way since I was born in the 70s, and my papa, Dr. Alex Spencer, that I'm named after, was a country doctor in Appalachia. I went on later in my life to become a primary care provider in the Navy. And so I've actually got some experience with knowing what a good healthcare system looks like and what an underfunded healthcare system looks like. And I think we're about to head to a serious underfunding of our healthcare system in this wonderful state.
I couldn't agree more. And I have to say, I love your Abraham Lincoln shirt that you're wearing today. I love
Thank you.
it.
Inspired by our trip to Hodgenville the other day.
I love it. So, on a lot of people's minds here in the 2nd Congressional District are the cuts that we're going to be seeing from HR 1, the one big, beautiful bill. And I just want to give everyone who's listening a timeline of how these cuts are going to take, like when they're going to take effect and what's going to happen, just so we know how this bill is going to progress throughout the years. So, we saw back in July how they passed the budget bill. And again, a lot of people are scared because of everything they heard in it. Uh,
It's the big bad wolf, the big bad bill.
yes, yes. So just moving through the timeline, on August 5th, we saw Kentucky healthcare facilities like U of L Health starting to cancel projects and cutting services and staff because they see these massive cuts to Medicaid in the future. So we've already seen that happen. And then November 1st, the ACA open enrollment begins with higher premiums. So that means that you're going to be paying more money for the ACA starting November 1st. And that's this year. So in 2026, on January 1st, the premium and tax credit changes and expansion funding cuts take effect. So your premiums are going to shoot up by 75% for marketplace enrollees. Certain low income patients will no longer qualify for tax credits, and federal funding decreases for Medicaid expansion will occur here in Kentucky. And that's January 1st of 26. And then October 1st, the federal funding will start decreasing for emergency Medicaid services all across America. And that just blows my mind to say that federal funding is going to decrease for emergency Medicaid services. Why would we want to decrease funding to help in those emergencies? But that takes
Well,
place October 1st.
the idea is that only the rich deserve to live. You know, only the upper middle class and the rich. And even the upper middle class aren't going to be able to sustain this for very long at all. So it's really
Yeah,
just going to be only the rich deserve to live and to survive.
yeah, yeah. That's what they're going for. That it really is, and it's so sad that we are moving towards that. And then
Amazing.
December 31st, we're going to see a huge increase in paperwork for enrollees that will kick in, forcing nearly 1.5 million Kentuckians to prove they deserve health care more often. So, again, that's December 31st of next year.
And
And
I
then,
see
I'm
that
sorry.
already happening, William,
Mhm.
because have custody of my teenage niece, and they've already made her. She's on Medicaid. She also receives some SSI, So they made us jump through some hoops to prove that she still deserves that, and they decided she doesn't, and that I owe $8,000 back to them.
Oh my gosh, that's
Yeah,
insane.
yep.
That is
And I
insane.
will not, I cannot pay that. Of course, I can't afford a lawyer to fight that. So here we go. All the things she needs now, and there are many. I just don't want to divulge her personal information, but it's the bullet has hit. It's
Yeah.
landed in our household on
Yes.
multiple fronts.
Well, on the same token, I was had someone reach out to me who actually lives in Hardin County with you, and they got their 2026 Aetna insurance plans, and they told me I could share this with everyone. But her dental insurance is going to be cut by 75%, and her glasses and her hearing aids both are going to be cut by 45%. And then she gets about $170 per year for Medicare, Medicaid help, and that's going to be cut down to $100. And she still
Well,
is unsure if she's going to get help with prescriptions.
and
So
that's the thing. You just reminded me. My niece now will not have dental coverage. So she's got an older sister that I didn't get custody of, unfortunately. And her older sister is, let's see, 19. Jen, now all her teeth are gone. This is Apple. She lives in Appalachia. We're already very low on services, and we're going to try to spread that type of thing to the whole state. Wow,
yeah, it's just unimaginable what they're trying to do. It really is.
it
And,
is.
and speaking of Appalachia, in 2027 is where we're going to start seeing a huge cut to healthcare. January 1st, we're going to see even more paperwork requirements that are going to kick people off of healthcare nationally.
Boy,
And people kicked off of Medicaid by January 1st will now be blocked from getting subsidy market coverage
there we
in
go.
2027.
That's where I'm at with
Yes.
with my niece.
And then in October 1st of 2027, this is the part that a lot of people have been freaking out about. This is where we're going to see a massive decrease in federal funding for rural hospitals through deep provider tax cuts. And we're going to see this hit really hard here in Kentucky because we are the state with the highest number of rural hospitals that are at risk of closing, 35 hospitals. Uh,
Oh my gosh.
and I just put on the
Mm,
bottom of the screen a little ticker of the 4 that's in this congressional district. We have the T.J. Sampson Memorial Hospital in Barron County, the Jane Todd Crawford Hospital in Greene County, Owensboro Twin Lake Memorial in Grayson County, and
oh
the
my.
Medical Center of Caverna in Hart County. So those rural areas. There's 4 here, and there's a lot in Eastern Kentucky, a lot of Appalachia. There's actually about 6 of the Appalachian regional hospitals that are on this list.
And
Uh,
that's where my grandfather provided care at a lot of those places when people would need more care than he could give in his private clinic. He would go there and take care of the patients there. He would be on call there in addition to his own personal clinic. My mother just recently spent 3 to 5 days in an ARH, Appalachian Regional Hospital, um, down south of Morgan County. She started off at ARH in Morgan County, and then they took her down to the one in Jackson, and she stayed there for about 3 days after staying in the one for 2 days. Um, she won't be able to survive without those hospitals. What's going to happen to UK St. Clair? Does it say there anywhere?
it does. St. Clair Regional Medical Center, UK St. Clair, is actually right below TJ Sampson Memorial Hospital at the top of the
So
list.
see, William, that's where they are training doctors to come back and serve in Appalachia. So I've got a wonderful cousin, younger than me. But she went to medical school at UK. She did her internships there at St. Clair. That was just down the road from her place in Elliott County, which is right next door to Round County, where Moorhead is, where St. Clair is. That is the largest medical center in Eastern Kentucky, from what I understand, what I've looked up. Matter of fact, I was just looking at their banner earlier. It said that they are just now starting to provide occupational health there. We have so many hard-working folks out there in those mines and other industrial type jobs, coming back from retiring, on the Hillbilly Highway, where they traveled from there up to, well, all over Kentucky, but went up, to say Chicago, Cincinnati, Columbus, and then now they've come back, retired, and they need this care. They need occupational health. They're not going to get it anywhere else. We closed down St. Clair, and these doctors that are being trained in the area that they grew up in, that region of Appalachia, St. Clair's where they're training, and they're supposed to go. The idea is from them to go from there and to be able to go back and serve that population. And some of those folks, because they're getting that rural healthcare training, they're coming out here to Central Kentucky, your district. They're going over to Western Kentucky. And they've got that rural healthcare delivery system training there at UK St. Clair. We're closing that down. We're putting the thumb right in the eye of all the hardworking folks in this state. Not just Appalachia. It sounds like just an Appalachian thing, but it's not.
Yeah, it's a statewide issue. Uh, I I have so many people, especially here in the second district, that are terrified in the Grayson County, Barron County area, because all of those hospitals are kind of clumped together in this district. The closest hospitals you have to go to are here in Bowling Green or up in Louisville, which could be anywhere from 40 to an hour and a half drive. And there are so many people going, well, if I have a medical emergency that I need quick help, I'm not going to be able to get to a hospital quick enough to survive. And
And
that's the reality of this situation.
it is. And I just did a piece the other night on here in Hardin County. We were supposed to receive a community-based outpatient clinic for the VA. We have the highest density of veterans in the whole state here in Hardin County, right? So people in District 3 and all the districts here, for the magistrate position that I'm running for, but this was going to be right in either in or on the edge of District 3. And when I'm looking at this, they said, oh, they were considering whether to allow it to be built, this clinic that we need, drastically. I have to travel an hour to Louisville when I need care, right? Or go on to Fort Knox, which is still in the county, but still not in my backyard, which this would have been. But folks in that neighborhood where it's supposed to be built said, oh, we don't want that traffic there. Now, William, how do you think that makes a veteran like me feel when I hear that you don't
Oh,
want your federal funding to build a clinic to take care of a large portion of your county? These are folks who served in one of the longest war in American history. The war that just recently ended, that Afghan-Iraq conflict, right? And you still got Vietnam veterans, Korean veterans, even some World War II veterans alive, served in this area. And you're telling me that, oh, having a little extra traffic is too much of an inconvenience for, to you, when it wasn't too inconvenient for us to serve Kentucky and our nation and then come back to this wonderful county, wonderful state.
yeah, well
So
said.
that was originally, it was going to be, they weren't going to let it be built. But then thank goodness Elizabethtown said, the city council voted on it separate and said, no, we are going to allow this. We will make this happen, make it work. They're building a Publix right in that same area. So you know what? It will have two great things if this goes forward like it should. But
Yeah,
it's, again, we got to care for people besides just the upper crust, just the 1%. Yes, we're a state that's so proud of our blue bloods, but by gosh, the hardworking red blooded Americans, we deserve health care.
yeah, oh yeah. And this isn't just a specific healthcare comment, but I know at least myself, my family, if I'm going to be inconvenienced by a little bit of extra traffic just to make sure our veterans have the health care they need, by all means, bring the traffic. I'll deal with it.
Absolutely.
Because
Absolutely.
you and I have talked personally outside of this, but I'm one that if you serve our country, we should take care of you, and that is providing that health care component as
Absolutely.
well.
And
So that
there's many veterans that they did their time. They really don't want to go back onto a army base. As strange as that may sound, but they don't want to go on to Fort Knox. Now, I received great care at the VA facility on Fort Knox. I will never say anything bad about it. Had nothing but good care there. But it would be so much more feasible for folks not to have to drive on that base. I don't know if you know, but with the president's hiring freeze, you may not have heard of this, but on Fort Knox, we were down to only having one gate open, only one gate to that large base because they couldn't hire any more of the base police. So had to have soldiers volunteer their time to go stand at the gate to wave people in, check their IDs, make sure they were safe. This is at Fort Knox. What else
yeah,
do we have right there? Oh, gold bullion.
yeah,
Oh my gosh, but we can't hire the security guards needed for one of the most important bases in the US. We can't be kind to the people that live in this area and keep the other 2 to 3 gates open that should be open.
yep,
Only one. That's a travesty. And then you're saying, oh, talk about traffic. So you've got people that need to get to their appointments at the VA. Now they got a long line up the only one gate open. Okay, if you're going to do that, then you better make sure we get our clinic off base.
exactly, exactly. Uh, and I know that right now we're just talking about HR1, but I do want to circle back around to the VA healthcare cuts that we've
Sorry
seen
for
with
going
this
off track.
administration. No, you're fine, but I do want to circle
They're
back
tied
around to
together.
that.
They're all
They
they're
are. Oh yeah.
yeah.
Oh yeah. So with these cuts though, something that was brought to my attention are two things that I didn't even think about with these rural hospitals that we're seeing. Uh, like I mentioned, people are going to have to travel farther to get to hospitals like in Louisville or in Bowling Green. But I didn't think about the repercussions to those hospitals. So think about if you travel and everybody in Hardin County traveled down to Bowling Green to our medical center or Greenview Regional Hospital, they're going to lose funding too. They're going to cut people out of jobs at these hospitals. They're going to cut positions. And then they're going to have more people coming to their area, to their hospital. So they're having to service more people with less staff. So
Well, not just
overworked.
that, William, but
Mm,
many of these hospitals, there's certain insurance that they won't take.
yeah,
My
exactly.
wife works at Costco, has a great health care plan there at Costco, but she could not get a treatment that she recently had ordered by Baptist. She needs ear, nose, and throat because she had breast cancer. Now we found a lump in her throat. We need to get that taken care of. They don't have ENT at Baptist, so she needed a I can't remember if it was a CAT scan or what it was, but she could either get it done at UK because we're having to travel to Lexington for her breast cancer treatment when it comes to the reconstruction and such, or we were going to have to go to Vanderbilt. We don't have all those capabilities for what she was needing. Her only 2 options were Vanderbilt or UK. So UK wanted an image to look at this lump in the throat, and we could have gotten it done at U of L, but U of L said, nope, we don't take your insurance. You're going to have to get that done at UK. Now you add all these people coming from all over the
Yep.
state now, you know, and we're going to have a nightmare. We don't have enough doctors in this state. Now we're going to have even fewer because we're going to close down UK St. Clair. You know,
Yeah.
uh, it's
Yeah.
mind-boggling the lack of compassion and empathy that this bill gives you a glaring example of right here with HR
Yes.
one.
And I will tell you this timeline, I didn't even get to completely finish everything that's going to be cut. There's more cuts past 27 that we're expecting too. Let me give you those real quick.
All right.
January 1st of 2028, fewer drugs will be eligible for the Medicare price negotiation, which means
Mm-mm-mm.
our Kentucky seniors will pay more for the medication that they need. That's January 1st of 2028. So after the presidential election happens.
Of course, they're going to wait till then.
Yes.
Of course. They
And
made sure
then,
that you'd be
yep.
bamboozled up until then.
And then the last one, October 1st of 2028, the new Medicaid cost sharing fees takes into effect. So some Medicaid recipients will be forced to pay these new cost sharing fees for every healthcare service that they get, which is going to be higher than what they're paying now. So
So it's not just my niece that has Medicaid, but also I've got a stepdaughter, I consider my daughter, that does. She's going to be horribly affected. Again, I'm not going to share her personal health care information, but this is going to drastically affect the whole family once she
oh
can't
yeah,
get care. You know, again, my wife, with what she's going through, she had to briefly, 2 years ago, when she, had cancer the first time, she was away from Costco so long, her insurance ran out, and she had to briefly go on Medicaid. So now, if that happens again with what we currently got going on, that's going to be three people in my family. They're going to be hurt severely. It
yep,
could financially possibly drive us into the ground, and people that make as much as you and I do, William, we're not allowed to go bankrupt anymore.
yeah,
The top 1% is, and we know we have a certain person in office who makes it a business practice to go bankrupt so he doesn't have to pay his employees, after they build
yeah.
things for him, his
But
union
we're not,
workers
yeah,
especially.
but we're not
So
allowed to. We have to keep
no,
working and making their money for them.
that's right. We got to pay
But
their taxes for them that they refuse to pay. You know,
yep.
so
But
this,
uh, you are talking about people in your life that will be affected. In your county, Hardin County, there are 30,705 people in your county, just your county alone, that relies on Medicaid. That includes our children. That includes, of course, working people like you and I. That includes our senior citizens. In my
well, it
county, oh,
especially covers our children. When we
yes. Oh, yeah.
went to, we know that it's basically nearly half of Kentucky babies are born paid for
Yep.
by Medicaid. Now,
Yep.
we are such a right to life loving state, and yet we don't value the life of the babies after they come out of the womb or as they're coming out. You don't want to pay for that.
Oh, we're
We're going
not.
to say if there's complications to that delivery of the child, that mom that's not going to be on Medicaid anymore, but should have been
Yep.
and would have been if it wasn't for this. She is, when she has complications in that delivery and she and the baby die because they couldn't get it paid for because they had to have it in the back of their car. What are we going to say? What kind of
Yep.
Jesus Christ that we were have here all the time, from the other side? What kind of
Yep.
Jesus wants that? Not the one that I go to church and talk
Yeah.
to.
Well, we'll see. And you hit the nail on the head. Everyone says that we're a right to life kind of state, but we're really a right to birth state because once you're born, we don't care what
No, but
happens.
we just proved it's not even a right to birth. It's
Yeah.
a right to up to the minute you give
Yeah.
birth, because it will your natal care won't be paid for. Your
Yeah.
birth won't be paid for. Actually, your prenatal care won't even be paid for. So we just have that right to be forced to hopefully feed a baby, because we're not going to give you food stamps that we're making
Yeah.
you have, or a fetus that we're making you have. Yeah, but
Yeah.
you're not going to get any care. You
Oh,
know,
none. None.
no. So you're right. We don't
It's,
care. It's not really a right to life.
yeah.
Yeah, it's a
And
right to suffer.
exactly. And I do want to say in my county, we have 45,743 people currently on Medicaid. And again, you mentioned children earlier. My sister and myself, we both had Medicaid growing up as well. My dad was self-employed. He cleaned parking lots, did landscaping, I feel like he almost worked nonstop and only got maybe 2 hours of sleep a night. And my mom
Yeah,
actually worked at one of the hospitals here in Warren County, but we still needed Medicaid to help pay for our health care. And that was
absolutely.
back in the early 2000s.
And
And
that's an absolute travesty.
yeah, yeah, and I think back to the dumb things I did as a boy growing up, all of the, "Hey, look at me, I'm gonna try this," type thing, and I'm surprised I don't have any broken bones, but I've we would go to the hospital so many times because I would do something dumb growing up, and they knew us by name.
As
Uh,
we're supposed to, as you know,
yeah,
that's what we're
yeah,
supposed to do.
and so I couldn't imagine if I was a child now in my family, with everything going on today, how they'd be able to make ends meet. I mean,
Well, as you probably know now, they weren't hardly making ends meet. They
yeah,
were just keeping it from you. You know, they weren't burdening you with that. But
yeah,
that should not be something that a family has to suffer and go through, at all. We're the
yeah,
only industrialized nation in the world that doesn't provide care for all of its workers. You know,
exactly.
I mean, how
Well,
many more small businesses would there be if we had health care for all? We had Medicare for all. You know, we'd have a lot
and
more entrepreneurs starting businesses, giving us a bigger tax base, but we would have truly more employees around
yes,
the whole nation. You wouldn't have to worry, oh, can I start a business and provide medical care for my citizens? I know they want to go back to where no one has to provide medical care for anyone, no matter what size your business is. But that's not what we need to go back to. They're trying to
yeah,
get us back there, but we need to provide health care for everyone. Uh,
yeah. So this is actually a great turning point. So thoughts on how we fix healthcare, how we fix the system.
Can I
But
give you a couple examples of what I've seen in my worldwide travels?
yeah, most definitely.
All right. So, like I said, I was a primary care provider, primary care manager in the Navy. I served from 1990 to 2014 in the Navy, and I was a hospital corpsman. So, an independent duty hospital corpsman, and we do primary care. So, one of my many deployments was um, overseas. Of course, they all are overseas with their deployment, but and out of continental U.S. deployment. One of them was on a destroyer. My destroyer, which is like a small battleship for those who've never been in the Navy, um, we were tasked with going up to the Arctic Circle for the first time in about 50 years. Right now, William, I don't know if you had a Encyclopedia Britannica when you were young, but I used to love to read through those things. I remember reading in the 80s that no one has ever found a passage across the top of the world due to the ice caps, right?
Interesting.
Well, thing is, the ice caps are basically almost gone now, and they've melted enough that ships can go up there and through there now. So, what does that mean? That means that ships want to go take their supplies of oil and other things that shipping cargo containers need to ship. They want that shorter passage from northern Europe across Canada over to the Pacific and vice versa. We also have a lot of oil up there that they want to drill into and start moving around. Well, as we went up there, I had two medical emergencies. Well, one was only a quasi emergency, but one major emergency. So we went into Greenland. As we moored in Greenland, one of the lines snapped back and
Oh
hurt quite a
gosh.
few people. Yeah. So one of these young women that was serving, I felt that she might possibly have a fracture since I didn't have an X-ray machine in my medical department on this small ship. I took her to the emergency room in the capital of Greenland. Now, the Greenland folks, there, as you've probably seen on the news lately, it's not fully independent from Denmark. It's still a protectorate, but they do have their own. They are independent as far as being completely ruled by Denmark. But the Danes still provide them with their medical care. And so the only hospital in that nation, which is in the capital city that we pulled into, they have free medical care for everyone. All right. And it was Danish doctors and nurses that manned this hospital. So I'll go in there with this patient. Actually, I had two patients, but the one that I was the most worried about. The first patient, we got him in and out pretty quick. The second patient, she got an X-ray, she got a CT, she got a full exam by the orthopedic surgeon who was also an ER doc on duty there. This treatment took probably 2 hours, if not more. The results came back, and she was bandaged up, casted up, treated wonderfully, amazing. Well, I wanted to make sure that the United States government, the Department of Defense, paid the hospital there. And the doctor's like, no, sir, medical care is free here in this country. I'm like, well, no, I still insist. The U.S. can't just come in, use your facilities. This, I know how much CTs cost. I'm in the U.S., so I was on the line with the bursar. It was located in London, and I was on hold for a long time. Finally, the doctor's like, sir, it's going to cost more to figure out how to receive payment from you guys than it is just to say, have a wonderful day and a blessed time.
Wow.
So we went out of there. I was just like, wow. Now, next, on our way back to the United States, we pulled into Canada. This was for the second time. It was St. John's in Newfoundland. And I had one of our sailors had gotten pregnant while while on deployment. So we weren't supposed to have any pregnant people on a ship away from a U.S. port. So I was trying to figure out how to get her off the ship and back to the U.S. Well, she didn't have a driver's license, even though she was 25. Go figure that. Had lost her military ID. I guess when she was going out in town, someone had always been signing for her, taking her back and forth. So it was a debacle. Well, I want to make sure that the urine pregnancy test was actually accurate. Took her to an ER there in Canada. As we're sitting there waiting in line to get an ultrasound, I'm like, you know what? I want to find out how these Canadians feel about their free medicine. Would they like to have American style medicine? This was right before the Affordable Care Act, also known as Obamacare. Okay. We always were hearing, this is right actually as it was, as it was just getting ready to go into effect, actually. So you always hear, oh, Canadians come across our border all the time because they hate their system. So I asked everybody there, 14, 20 people. Now, granted, it wasn't quite scientific. It was scientific enough for me when I saw the reaction. Hey, I'm from America. I want to see if you would like to have our medical care instead of yours. Oh my God, are you crazy? I won't say the expletives that other people said to me. What on earth? They were very upset that I would suggest such an asinine thing. We go in to get the ultrasound. I've seen an ultrasound like that for babies. It was in color.
Really?
The free ultrasound they got, that
Oh my
all of them
God.
get there in their ER, was in color. We got to look at that fetus in color. You got to
That's
go to a
crazy.
high-speed hospital and pay extra for that if you can find it in the U.S.
That's
This
crazy.
was, I've been retired since 14. This was back in 2010, 2011, somewhere in there. Can you imagine that? So that's looking at Greenland and looking at Canada. Let me back up a few years now. Before that, in about 2006, 2007, I was stationed in Sardinia, Italy.
Okay.
My stepdaughter had an emergency, dire emergency, had to go to the hospital. She was taken to Italian hospital. In the hospital a few days. I actually was deployed at the time to Africa, so I don't, wasn't there for this event. But all I know is excellent free medical care because that's what they have in, Italy, all of Europe, just about. And yeah, how much do you think we got charged?
Um, Either zero
Zero.
dollars, yeah,
Zero would be correct. Yep,
yeah,
zero is correct, right? So, you know, I can't fathom the fact that a country, I loved Italy, but my friends over there, call themselves Mexico number two when it comes to where they
right,
are as far as truly developed. When it comes to
okay,
southern Italy, now northern Italy, yeah, they get they're wealthier, but even not being the top tier so-called European country, they provide great free medical care for their folks.
yeah, and
It's
that's what we need here so much. Uh, I'm a big proponent of Medicare for all, which is like that single payer healthcare system we've seen all those countries you're talking about. It's
yeah.
such a complicated issue that every other developed nation in the world, except for us, has figured it out, but we just can't seem to figure it out. It's so
No, we can
complicated
figure
for
it out. We figured it out, but who is
us.
gross profits off of this?
Oh yeah,
That's
oh yeah,
the for-profit healthcare
yeah,
entities and the pharmaceutical companies
yeah,
here. You know, those two together. That's the yeah,
yeah. Well,
that's the
and
culprit.
I have a few points I wrote down just for anyone watching. They're going, "Oh, Medicare for all is a horrible system. It's not going to do X, Y, and Z."
Well,
Well,
I've seen it overseas,
yes,
so
but
I
I
just
just
gave
want
you
to
three
make sure.
accounts.
Yeah. So the first thing I want people to realize watching this is that it's cheaper than our current healthcare system. And especially after spending the last, I don't know, 6, 7, 8 months. Oh God, I said 6, 7. If any kids are watching, they're gonna be freaking out uh, about waste, fraud, and abuse. Why would we not go to something that's gonna be cheaper for us in our country? That's been the battle cry. We need to save money. We need to save money. We're spending too much money. Medicare for all is cheaper for us as a whole
Well,
compared to
William,
our system.
do you have the stats there on back before the Affordable Care Act came about, right? If you didn't have health care insurance, where did you go, William, to get your care when you needed it? When it was like down to the nitty gritty, you're going to die if you didn't go get some treatment. Where did you go to get your health care?
Oh, that's a very good question.
You went to
I
the
didn't think of
ER. Who paid for that? Who paid for the ER
the
bill?
the taxpayers if you couldn't, right?
The taxpayers. And by the time you go to the ER, how much more is expensive is an ER trip than a trip to your primary care provider on a regular basis, on an annual basis? It's much,
Much
much,
higher.
much
Oh, yeah,
more
much higher.
expensive if you don't get your preventative care. And by the time you have to go, it's an ER trip that you cannot pay for. Then by the time it's said and done, the taxpayers pay for it. You know,
Yeah,
when I was
exactly.
in nursing school in Nashville, Tennessee, in the late '90s, mid to late '90s, I had to make an emergency room visit. I had one side of my face go numb, twitching in my eye, and I was, I started to feel nauseous and dizzy, blurred vision. Like, oh my gosh, what's going on here? I called my grandfather, who was still alive at the time. Was like, Papa, what do I do? Asked my symptoms, like, what on earth are you doing up this late? Because I was up cramming for a test. It's like, go to the ER right now. So I went, got a spinal tap,
Oh gosh.
yeah, all kinds of blood work done to tell me that it was a viral syndrome. $20,000 later, I can't pay for it. I had to leave my last year of nursing school
Wow.
and run back into the Navy, as an enlisted person. Didn't get the commission that I intended to. If I completed that degree right then and there, I would have been a nurse corps officer. Instead, I later on completed a health sciences degree. Still, like I said, I did primary care when I got that extra training in the Navy while I was on active duty. But, you know, no one should have to give up
Exactly.
their career choice because an emergency comes up that turns out to be, a viral syndrome. I should
Yeah.
have had healthcare insurance that could have covered that and let me keep on sailing.
How many people do you think in America are currently uninsured or or underinsured with their health care?
Boy, since I know that we've reduced it since we got the Affordable Care Act. Well, I'm sorry, the real word for it should be Obamacare, but
Yeah. Yeah.
they're not they're the same thing.
Exactly. Yeah. So the last estimates that we saw, we have about 27 million Americans who are currently uninsured or underinsured with their health care. Medicare for all would fix that in a heartbeat because everybody would have that health care, and health care that includes all of the extras we see in insurance, like your eyes, your teeth, your hearing, your mental health. Uh, and I
Well,
want
that's
to
one
say,
thing we want to be sure of because right now a lot of healthcare plans do not include dental coverage,
yes,
and that's just as important. You get it. That same trip that I took to Canada, I had a patient who had an infection in her molars. Uh, Pumped her full of antibiotics. We got to a dental clinic in Canada. It turns out in Canada, that's the only thing that their free healthcare didn't cover was
okay,
dental. And okay, I hate to knock on Canada since I was saying so many good things about them, but the dentist there did not take care of it properly. So we get back out to sea. She's still having horrible pain, nausea, vomiting, fever, and this is all coming from the infection there. Pumping her full of antibiotics.
mhm,
Have her on bed rest in my medical bay. Get back in port on a weekend. Had to call in the duty dentist, the Navy duty dentist on the base, and he told her if I had not been pumping her full of those antibiotics, it would have gone to her brain. The infection would have, and she would have died.
gosh,
You know. Now, how many people do we need in America? Do we need that to happen to? Because we refuse to provide something as simple as dentistry to every single American. You know,
yeah,
we need to make sure that that's
yeah,
included in any plan we come up with. You know,
exactly,
you don't
yeah,
need to miss
because
work because of something like that.
exactly, and I do also want to point out the mental health. Um, in my school a couple years ago, about 2 years ago, actually, we had in September of that school year, we had a young lady take her life. And then a couple months later in my high school, we had a young lady do the same thing.
Mm, mm,
And
mm.
I feel like if we had better mental health services, and we had mental health services in our schools, but they was kind of sporadic. A few days at this school, a few days at that school. But even if we had it outside of school to where that those students could go see the mental health professionals and having that to where they didn't have to worry about paying for it, they could get the help they need. I feel like those two young ladies would still be here with us today. Mental health is so important, and the fact that we exclude a lot of people exclude that from healthcare is just it's mind-boggling. I mean, when we see shooters, mass shooters, they always want to say, "Well, it's a mental health issue." Well, how are you going to fix mental health? We're not. And they have no solution.
Can I chime in there?
Yeah,
Okay. Now, you and I might disagree on this. I don't know. I support all of our amendments, including the Second Amendment.
yeah,
But if we don't do what you're saying, you always say, "Oh, that's the problem." They say, like you said, "Oh, the problem is mental health in America." Then why don't you do what you can
exactly,
do about it? It's
exactly.
absolutely not hard to do something about this. Instead, we have people, what the guy on Fox News saying we just need to shoot people that are homeless. Well,
Yeah,
a lot of these people are only homeless because they have mental health issues that we refuse to take care of and refuse to pay for and refuse to help
exactly.
them with.
Exactly. So we need a healthcare system that covers mental health as well.
Yes,
So Medicare for
just
all does that.
yes, yes.
It does
Well,
that. So
Medicaid does that, but we're
yeah.
cutting people off of it.
Oh
That
yeah.
it shouldn't be cut off, making it way harder to get it than it should be.
Yeah.
That should not be so hard to get. It should be the easiest thing in the world for people that need it. You know, um, this whole idea that we're going to make people, if they get Medicaid and if they have mental health issues, there's also been talk, if you recall, of them having to go work on these farms that they've
Yep.
taken the migrants away from, and because now we know that the fruit and vegetables are rotting on the vines because we don't have the migrants there, and now you're going to send the mentally ill out to do this job.
Yeah. Exactly.
I don't know if
It's
they obviously don't have any experience um, in dealing with loved ones or friends with mental illness. Well, we know they don't have friends because they don't have any empathy. So yeah,
yeah.
if they did have someone who had that, they
Yeah.
wouldn't be their friend anymore.
Yeah.
Because empathy isn't in
Well,
their vocabulary. It's a bad word.
yeah. Yeah. To them, empathy is the word that they never want to hear because they don't have it. They don't.
Nope, nope. They want to
Um.
talk all about Jesus, but
Yeah.
you
Yeah.
know,
And so another thing that I do want to mention when it comes to healthcare is I know a large group of people who stay home and they don't really get a chance to go out and work traditionally because they're at home taking care of their children with disabilities and having to
absolutely.
fight to get the health care that those children need. And again, being the stay at home nurses for those children and parents on top of it. And we need to make sure that those parents they have what they need because it's just so sad seeing them struggling when all they want to do is take care of their child, these precious God-given human beings to this world, and they're struggling.
William, and I've got you have just nailed it on the head. I've got a dear friend of mine, veteran. He and his wife are both veterans. She did one tour. He retired from the military. He's one of or they're both your Hardin County constituents. I'm sure they'll vote for you. I won't say their names because they do have an adult son that um, that they'll be taken care of for life. And he is so dear to them. I don't want to start crying right now on it because these three people are so dear to me,
Yeah,
and I must see you win so we can be sure that they get what they need so they can do the hard work they're doing. There are programs right now. They have respite care that they get that's federally funded. You know, they get a chance for him to go off with a social worker, engage in normal adult activities, watch a movie, go do something, entertaining for this young adult. He isn't, well, he's an adult. He's not, he's 21 now. But that they need that, they need that respite because they are constant caregivers. They're just amazing. Again, this dad served the nation in a time when we were at constant war.
yeah,
You know, multiple deployments, and we can't have some compassion and empathy to help them live a life of dignity and to make sure that their son continues this for the rest of his life, this life of dignity.
yeah,
It's not, in the name of Jesus, that's not
yeah.
what
It's not.
I remember in my church services hearing. I
Yeah,
remember hearing empathy, empathy, empathy. That's all Jesus had.
exactly. And I remember taking care of everybody, helping everybody whenever you could.
The widows and orphans.
Yes,
That was that was the big call. Boy, how
yeah,
far we've got from that. Matter of
exactly.
fact, William, I'm sorry to bring this up, But in church today, our liturgy was exactly about this. It says,
Okay.
you cannot serve wealth and God at the same time. We had that parable of the wicked manager of this man's business who was basically spending the owner's funds,
Yeah.
corrupt. You recall that one?
Yep.
He tried to make a last minute deal to save his rear end so he wouldn't lose his job and livelihood and never be able to manage anyone else's business again. and, and it said clearly, you cannot serve wealth and God at your same time. You can only have one master,
Yep.
one person you serve, one thing you serve. And it's either going to be your wealth and hoarding it up. And that's all we're talking about here.
Yep.
Why are we cutting healthcare? So that the wealthy can hoard
Yep.
more wealth. It's that simple. How many yachts can you buy?
Man, I'd be lucky if I could just get a little pontoon boat that has a hole
I'm
in it.
That's my dream, is just to have a little old used aluminum John boat, exactly, or a
Yeah.
pontoon boat. You got it exactly. We got some great lakes and rivers here that I'd love to float
Oh
down
yeah.
on. You got it
Or hey, even just
exactly.
a kayak, man.
I do have one
So
of those.
I don't have one of those, but all right. So any closing remarks we have on healthcare? Anything you want to leave our viewers with?
I just want to leave it. I've got so many friends and families members that they need this bad. My mom is 80, and she needs a lot of things that, again, I'm not going to share her medical information, but boy, oh boy, you know, I, 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 I can't afford the things that she needs, and that Medicare, she needs it. Um, my nieces both need their Medicaid. You know, please, folks, have some compassion. You know, let's 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 ask everyone in Congress to do the same.
Yeah. So healthcare is one of the few issues I feel like it touches everybody. We're all going to need help when it comes to healthcare. That's something we can't skirt around, and we need to make sure that we have access to healthcare for everybody. We don't need to turn anybody down, regardless of how much money they make. We need to make sure everyone has that right to healthcare, and that's why I'm running for this seat. That's why I'm a big proponent of Medicare for all. And that's why I tell everyone that on day one after being sworn in, the fight to repeal these cuts we mentioned earlier in the budget bill needs to start happening. Uh, I truly believe it's a human right. And if we keep denying that from people, then we are lacking that empathy that we've mentioned so much. And we are uh, not doing the Christ like thing by helping out our friends and
Absolutely.
neighbors.
Thank you. Now, there is one thing I want to point out to you, though, William, before we do close.
Yeah.
If you get elected, and if you decide you want to be a one-term guy, that's all you were, you'll get health care for life. Did you know that? You go to Walter Reed and
Interesting.
receive the same health benefits that my brother received when he lost his leg and hand and got treated there for many years. The rest of your life, you could receive free health care, and you will receive free health care. Every person in Congress that votes against the little man gets free health care for the rest of their life. Every congressman and woman and every senator gets free health care after just serving one term.
Yeah.
So that should say it all.
Yeah.
They know that they don't have to worry again, no matter which way they vote on health care. They're going to get it for life.
Yep. Let's make sure the American people have that worry free healthcare.
Absolutely.
So, all
Well,
right.
I
So,
say let's love one another and take care of each other. We are our brother's keeper. What do you
exactly.
think?
I couldn't agree more. Could not agree more. So this has been a very productive, very amazing conversation about healthcare. And there's so many facets of it we still have not touched on because it's such a huge overarching uh, issue that we're facing in our country. But our next episode next week, we're going to hit on something that both of us, again, have in common, and that's education, both of us being teachers, and how we can make sure that we have a brighter future for future students and to
And I appreciate that because that's
our education
really
system.
my first religion almost, is making sure everyone's educated.
Yeah,
Yeah.
exactly. So thank you all for joining us for Compton's Corner. It's a fantastic episode, and we'll see you next week.
And the Hillbilly Think Tank.
Yes,
Yes, sir.
and please make sure to go visit Hillbilly Think Tank. Are you on YouTube as well?
I'm on YouTube. I've got now a
Awesome.
Facebook page, E. Spencer Keck, for Hardin County Magistrate District 3. Yes, sir. You check that out and be sure and check out your page. Let's get you elected.
And same to you as well. Thank you all so much.
Have a great night.